Good evening, everyone, and welcome to Fremont Bank's exclusive event on COVID-19 update, the mutation and vaccine safety. My name is Helen Liu, and I am the Vice President of Private Banking. I've been with Fremont Bank for over 36 years, and 22 of them are as an account officer for Washington Hospital, and truly enjoy our partnership. Okay, so we have 68 participants right now, and we're expecting about 180. And we have only 1 hour to cover a lot of information. So here's how this evening's going to work. We have received over 14 pages of questions at the registration, and we are going to try to get through all of these questions during the presentation. So bear with us. And if you wouldn't mind, please, everybody put your smartphone or device on mute so that we are able to hear the presenter. Additionally, we will also be recording this session and making this available at the YouTube at Washington Hospital, and also available on channel 78, and that's the Washington Hospital's TV station. And at this time, what I wanted to do is to hand over the mic to Kim Burdick, our Executive Vice President. Kim?
Thank you so much, Helen. First of all, I want to say thank you for joining us for Staying Healthy in 2021. We will be joined by both associates and clients of Fremont Bank. But this has been a challenging 12 months, and we certainly miss you. I'm pleased to share with you that we've done 3 blind studies and have confirmed that Fremont Bank has the best clients of all banks anywhere. And so, with this research and scientific work, we're pretty excited to share with you what we already knew in our hearts, that one of the most important things that makes Fremont Bank special is the special clients that choose to do business with us. And so we thank you for that as well. In the history of the company, Morris Hyman, our founder, believed that the pillars of a strong community required quality schools, access to parks for family socialization and activities, strong medical facilities, and the presence of a healthy, responsible bank to fuel the growth of our community. Our relationship with Washington Hospital goes far back, but that relationship is guided by those principles of Morris Hyman, our founder, who knew that a quality community needs access to quality healthcare, and Washington Hospital represents all of that. Joining us tonight to lead our discussion is Dr. Jeff Stewart. He's the Chief Medical Officer at Washington Hospital, and we're so grateful that he has made himself available to answer our questions, share the latest information, and help us better understand how to stay healthy in 2021. With that, let me turn it over to Dr. Jeff Stewart. Take it away.
Thank you, Kim. And I would just say, on behalf of Washington Hospital, we really appreciate the opportunity to be here. And just briefly on my background, I've been the Chief Medical Officer at Washington for almost exactly 2 years, actually, about a week ago. You could say I had bad timing, but I actually view it as the whole COVID experience as a real educational experience. But I've been part of Washington Hospital for over 25 years, so I'm fully aware of the relationship with Fremont Bank and all the great support Fremont Bank has given to the hospital. So it's really a pleasure and my privilege to be here to talk to you all today. And just, as I said, I've been CMO for a couple of years. I am also an anesthesiologist, and was, prior to my current role in the system, was the medical director of Washington Outpatient Surgery Center for approximately 15 years. But as challenging as this past year has been for all of us, I know everybody on this Zoom, and he's specifically referring to everybody working in healthcare and at Washington Hospital, it's really because of our community that we're able to thrive, and it's really what drives us to work our way through this and endure such a challenge as we've had over the past year. In my work, actually, obviously, was involved with a lot of the COVID work during the taking care of the patients piece of it, which is still ongoing, and all the challenges regarding a new disease, and especially in a level of a pandemic. But knowing that the vaccine was coming, as we all sort of knew that towards the end of last year, kind of was a ray of hope for all of us, and really one of the impactful things I've been able to be involved with at Washington was really being a part of this team that rolled out the vaccine initially to our employees at the hospital, the physicians, healthcare workers, and then beyond within our hospital, and subsequently out through the community. We were for about, I don't know, 6 months even before the vaccines even became available, with respect to the logistical and other challenges, trying to, play without really knowing the rules, so to speak. But it's we've done a great job, and just going to briefly tell you a little bit about that, our vaccine rollout and vaccines in general in Alameda County, and just what I know, kind of what's coming as far as volumes, et cetera. And then Dr. Catalia, who will be following me, as an infectious disease specialist who joined our foundation last summer, who can speak more of the details of a little bit of the COVID itself and the vaccine. So as I said, we've really worked hard at Washington Hospital, planning far ahead, knowing that even beyond our own employees and the doctors in our medical community, that we were going to be a key cog in helping vaccinate the hospital district at large, which is what we're committed to. How that is all about, it's really been, as you know from reading about it, a lot of fits and starts, especially at the with respect, mostly with respect to not really being able to plan on an exact supply week to week, but also the moving target of who was eligible for vaccination. At the beginning, it was quite clear that it was healthcare workers and people supporting the healthcare industry. But since then, it has expanded as in this confusing tier level of eligibility. And I will tell you, if you were confused about it, we have been just as confused about it, because talking to the county essentially almost every day through much of this was definitely a moving target. So instead of illustrating it as tiers, what we've gone to now, because we are heading into a broader level of vaccination here, is because the tiers, I think, can be confusing. And even on the Alameda County Department of Health website, while they do still have tiers listed, they are also going to this, as you see in the slide, just general eligibility, to make it, I think, a little more understandable, so people don't get so hung up on the tiers. And again, this information is from the Alameda County Department of Health website, which is an excellent resource. I would recommend it if you have been following it, or if you haven't been following it throughout COVID, and with respect to testing, case rates, all sorts of stuff, but now with a lot of information relating to vaccines. And as you can see, the eligibility over the past, it's really not been that long, even though it seems like it's been a long time since we first started giving vaccines at the end of December. Really, over the course of not much more than 3 months, this is where the eligibility currently stands. We did branch out pretty quickly once we got outside of healthcare workers into the essential workers in various industries listed here, as well as the older population of residents over 65. More recently, within the last few weeks, we've been able to add residents who are 16 to 64 with certain specific complex health conditions, which were pretty well delineated by the state and the county for us. And we've just been working within their guidelines. And then what's had a real impact is getting the high-risk congregate living setting people vaccinated, specifically relating to our hospital, those in the nursing homes and the skilled nursing facilities near our hospital. If you look at the data on that, as far as cases before and after, at this point, most of them have been vaccinated. It's a real encouraging sign for the power of vaccination. Homelessness, obviously an issue throughout California and elsewhere, and these people are in tier now as well as those involved in public transportation, as noted on this slide. Again, this change is this has been evolving and changing very quickly. What's going to simplify it greatly is coming up here at the end of the week. It's going to really go to just essentially age-based. So it'll be everybody who's already eligible, and then starting on April 1st, those that are 50 years, and then starting in mid-April, those that are 16 years and older. And really what this is based on, and just from what, being involved with the communication with the state and the county, is there's going to be a real uptick in the amount of vaccine available. Not only because we had a third vaccine, the Johnson & Johnson vaccine, approved, and again, Dr. Catalia will speak to some of the details on the vaccines, but really the fact that even with the Pfizer and Moderna as well, the supply and all the great work that's been done on the federal level and otherwise to really focus on making more vaccine quickly, and partnerships within industry, it's been really interesting that's really, while we're doing great, as you'll see on the next slide, ability to have a situation where the supply of the vaccine is not the issue will be very exciting, although challenging in its own right. And so here again, this slide is data from the Alameda County Department of Health website, and this kind of is a snapshot from a couple days ago with respect to the number of residents vaccinated. As you can see, it's been quite an undertaking here, given that weekly, I think initially we're only getting about 3,000 doses of vaccine, to the county originally, and now it's really expanded greatly. As you may or may not know, there were some federal pieces that were not going through the county. The setup at the Coliseum was that some of the work with the congregate living through pharmacies and other organizations was part of that. But this is really where we're at now. So we're basically at almost 500,000 people. I'm guessing we're over that now, a couple days later, who've had at least one shot within Alameda County. And so that's translated into approximately 40% of the residents. So that's really impressive. And about 25% of the residents fully vaccinated at this point. So this is really exciting, and this is consistent with national averages in other states. I was asked that question earlier today, and we researched that. So California, despite a little bit of a bumpy start here, is progressing well, and I would say, having partnered with them throughout, our county has really done a good job working with not just the hospitals, but all the healthcare entities involved with vaccination in our county. So with respect to our in-house vaccination, I should say, at Washington Hospital or through Washington Hospital, we have, again, we can add a few thousand more onto this, actually, as I noted, because the slide's a couple days old. We've done about, over 26,000 vaccinations total, and this is relating to over 15,000 people vaccinated. As some of you may be aware, we're running a clinic daily in our 2500 building, just across the street from the hospital. And then as you can see in the photos there as well, I've been able to take part in this, but it was very exciting. Some big drive-through clinics as well for second doses of people, even occasionally first doses now. And it's been exciting. And we're really just talking today how we can keep this going, especially as all the numbers of people eligible will be greatly accelerating. A big part of again, I know most of you are aware of what the state's doing, and the county's done a great job of this. And, we are focused on it as much as the county and the state is trying to really prioritize equity and reach out to the community with respect to our vaccination efforts. While the majority of our vaccines have been delivered, on site in Washington, we have had some experiences going to various spots, including some local businesses, to do some targeted vaccination there. Some of them are listed here. We've made arrangements for folks at these organizations to come be vaccinated at the hospital. This is really exciting, as you can tell, hopefully, me talking about it. This is kind of the piece of the process of working our way through the pandemic, which is, really near and dear to my heart, because it's really our ticket to eventual normality. Even building on what we've done in the community so far, we do have future plans, again, because this is going to be a marathon, not a sprint, as far as continued vaccinations for the next several months at least, I believe, in my opinion. We're expanding community outreach more, working with various community organizations, including churches, other local clinics, et cetera. So we are constantly planning day by day, and again, working in parallel and in cooperation with the county and several other organizations. And so really this is just emphasizing what I've alluded to a couple of times in the talk, is that, we really, Washington Hospital, the mission is to, be the healthcare provider and serve the healthcare needs for all the residents of the Washington Township Healthcare District. And this is something that, with respect to this vaccine rollout, is especially key, as for many reasons, as some of which I've noted. And we really want to continue to strive to lead in that respect. And Kimberly Hart's, our CEO, from the very beginning, was very adamant about being a hub of vaccination for the residents of our district. And this will, as things have already, and they will continue to do so, there will be more places to get vaccines, but we are committed to doing as much as we can as possible and trying to max out on our efforts. And again, I really feel like the supply of vaccine that's going to be coming online will really be a game changer for a lot of states, and I think the country as a whole. I'm hopeful. And just one thing I did want to address is, as I noted, we have been working in concert with the county the entire time. You may have read some in the news about a third-party administrator through Blue Shield going to be taking over some of the vaccine distribution for the state of California. There was some controversy with that with respect to the interaction of the counties and this third-party administrator known as a TPA and the state. But my information, our sense is that there has been sort of a détente reach where everybody's going to cooperate, and the counties are still going to have influence on the third-party administrator and how vaccine is, who vaccine, I should say, is distributed to. So even though we may be not getting our vaccine starting in April at some point, we're not sure exactly when, delivered from county sources, but rather from state sources, we still will be working with the county, and we're hopeful and actually quite confident now that should not affect our vaccine rollout. And I think, to a degree, as far as being able to, track vaccinations and be able to figure out targeted places where it will be needed going forward, I think actually the pluses will outweigh the negatives that you may have read about in the news. But in general, thank you again for this opportunity, and really appreciate the chance to talk to everybody here. I am very passionate about this, so I'm very happy to talk to anybody about it at any time. And we're very lucky to talk more about from an infectious disease perspective, as far as with additional expertise on COVID and the vaccines. Dr. Stephen Catalia, who joined the Washington Township Medical Foundation in August of last summer. But he really has a unique perspective, I think, among us on COVID, though we've all lived through it, and some of us lived through it on the working from the hospital side. Dr. Catalia was in New York, actually, I think working at Mount Sinai hospitals, but I will let him take on from here during much of the pandemic before he came to Washington. So he's brought that expertise and perspective to our organization. So with that, Dr. Catalia, I will turn it over to you.
All right. Thank you, Dr. Stewart. And yes, again, my name is Dr. Stephen Catalia. I am one of the infectious disease doctors that joined Washington Township Medical Foundation in August of last year. Prior to that, I was working in the Mount Sinai hospital system in Beth Israel, West, and Morningside, where I was working as an infectious disease doctor from 2018 through 2020, which was a very interesting way of ending my time in New York City. And, I did grow up in the Bay Area, and it's definitely great to be back also. So I suppose if we can get to my slides. All right, so again, there's my title slides. Outline of some of the topics we'll be addressing tonight in my talk. Vaccines, obviously, it's been talked about a lot lately. We'll talk about their safety, efficacy, and other concerns. We'll give some updates on what's been going on with COVID-19 recently, and also in with the pandemic and with the variants, because that's been talked about a lot lately also. And also give some insights onto patient symptoms and also the recovery period, because that's been talked about a lot as well. So first, with vaccination, the importance of vaccinating. A vaccine will may help keep someone from getting seriously ill if they get infected. Vaccines protect those around you, particularly people at increased risk for severe illness. Experts are continuing to conduct more studies about the effect of vaccination on the severity of illnesses, as well as its ability to keep people from spreading the virus that causes COVID. Getting COVID may offer some natural protection going forward, but how long that effect lasts is unknown, and the risk of severe illness and death from COVID far outweighs any benefits of natural immunity. And then also getting the COVID-19 vaccination will help protect by creating an antibody response without having to experience the actual illness itself, including needing to be hospitalized or, God forbid, needing to be hooked up to a ventilator. Wearing masks and social distancing do help reduce the exposure to the virus and also the spread of the virus, but these measures by themselves are not enough. The combination of getting vaccinated, wearing masks, and social distancing to protect yourself and others will offer the best protection. And really, to end the pandemic, we need to use all the tools we have available. So just quickly to highlight how vaccines have worked in the past and how they've been successful. The smallpox vaccine was first described by Edward Jenner in 1798, and that led to the ultimate eradication of naturally occurring smallpox in 1977. The first polio vaccine was available to the US in 1955, and thanks to widespread use of the polio vaccine, the US has been polio-free since 1979. I included a picture there of Elvis Presley getting vaccinated on the Ed Sullivan Show in the late 50s. Elvis getting vaccinated on TV was credited with helping sort of popularize or showing that it is in fact safe and to get vaccinated, and getting vaccinated is a good thing. And then talking about mumps, before the US mumps vaccination program started in 1967, mumps was considered a universal disease of childhood. But since the pre-vaccine era, there has been a more than 99% decrease in mumps cases here in the US. So currently, there are 3 vaccines in circulation here in the US to stop the spread of COVID. The first 2 are the Moderna vaccine and the Pfizer-BioNTech vaccine. These are the messenger RNA-based vaccines, which require 2 shots. These are the ones that were rolled out to great fanfare back in December of 2020. And then more recently, we have the Johnson & Johnson vaccine, which is a DNA-based vaccine, and that only requires 1 shot. There are 2 other vaccines currently in different stages of development. More recently, we've heard about AstraZeneca, which is a vaccine that has been rolled out in other countries in the European Union, in the UK, and also in Canada, amongst other countries. And there's also another vaccine created by Novavax, which is also in development and will likely undergo review for approval in the coming weeks to months. So in terms of first how the Pfizer and Moderna vaccines work, they teach our cells how to make a protein, or even just a piece of a protein, that triggers an immune response inside our bodies. So the COVID-19 messenger RNA vaccines, which are the Pfizer and Moderna vaccines, they give instructions for our cells to make a harmless piece of what is called the spike protein that's found on the surface of the virus that causes COVID-19. So I included a picture here. That picture right there in the middle is the coronavirus particle. And we basically seen this picture, or a variation of this picture, now for more than a year in social media, on the news, and the internet. And it's the COVID particle is basically this sphere with these different little protrusions that stick out from that sphere. And those protrusions are bits of protein that are called the spike protein. And I drew an arrow right there to highlight what the spike protein is, because that's something to keep in mind as we talk about the different vaccines and how they work. So basically what happens, messenger RNA is injected into the person's arm. Muscle cells then use that messenger RNA to make the spike protein piece. Keep in mind, by the way, we're talking about a genetic material called RNA. That's not the same as DNA, which is, the stuff we hear about in like crime shows and Maury Povich and paternity testing, etc. But basically, the muscle cells use this messenger RNA to make that spike protein piece that we talked about just a few seconds ago. The muscles then dispose of the messenger RNA that was injected into your arm, and they display the spike protein to your own immune system. Our immune systems then recognize that the protein doesn't belong there, and it starts making antibodies to that spike protein. So these antibodies that we make in response to the spike protein remove the spike protein, but fortunately for us, they decide to stay in our systems. So, God forbid COVID-19 ever comes into contact with you or with us, these antibodies can stop COVID from causing a major illness. So in terms of how the other COVID vaccines work, to just touch on those really quickly, the AstraZeneca vaccine, which is pending review right now and has not been authorized for use here in the US, but is authorized in other countries, and the Johnson & Johnson vaccine, which is authorized for use here in the US, they use DNA. So they use that genetic material that you get to hear about in crime shows and paternity testing. They do not use the messenger RNA. But otherwise, the way those two vaccines work is pretty much the same. Your body does pretty much the same thing. It takes that genetic material, forms a spike protein, displays it to your immune system, and then your immune system makes antibodies against the spike protein, and it provides you protection against COVID. The other difference, of course, is that the Johnson & Johnson vaccine is only one dose, whereas all the other COVID vaccines that are being given out right now, and also the AstraZeneca, require 2 doses. That being said, Novavax, which is the other vaccine that I have referred to in this talk, avoids genetic material altogether. And that one injects the spike protein directly into your arm. So it bypasses that part where the muscles take your genetic material and make the protein. And then your body just looks at the protein and then makes antibodies directly to the spike protein that's injected into your arm. Next slide, please. So in terms of how well do they work? So we'll talk here about the Pfizer, Moderna, and Johnson & Johnson vaccines. Those are the 3 that are available right now for use here in the US. So first, the Pfizer vaccine efficacy, known as effectiveness, in preventing confirmed COVID-19 occurring at least 7 days after the second dose in their clinical trial was 95%. And that was with a study that had 38,000 participants. Of note, Pfizer reported that were 8 COVID cases in the group that got the actual vaccine versus 162 that got COVID in the placebo group. So basically, the placebo group was a group of people who participated in the trial but did not get the actual vaccine. They just got a small amount of water or saline injected into their arm. Moderna vaccine efficacy in preventing confirmed COVID cases at least 2 weeks after the second dose was also very high, and that was at 94.5%. And again, that was in a study that involved a huge amount of people, specifically 30,000 participants. And in there, they found 5 cases of COVID in those who got the vaccine versus 90 who got the placebo, the people who got the saline or the water injected into the arm instead. Johnson & Johnson vaccine efficacy was technically lower at 66.9% when considering cases occurring at least 14 days after their single dose vaccine. In vaccine and placebo groups respectively, there were 116 cases in the people who got the vaccine versus 348 cases in the group that got the placebo, and that was at the 2-week mark. But the important thing to factor in here is that the Johnson & Johnson vaccine was tested in areas known to have the South African variant. The Pfizer and Moderna vaccines were tested in areas that were not known to have the South African variant at the time, and that's something we'll be touching on in a little bit. In terms of the side effects for these 3 vaccines, first for Pfizer, and you'll see a recurring theme here, the most common side effect was what Pfizer called injection site reaction, but that's basically pain at the site where the needle goes into your arm. And that was in about 84% of those who participated. Fatigue was the second most common at almost 63%, followed up by headaches, muscle pain, chills, joint pain, and then fevers. Severe reactions occurred in less than 4.6% of those who participated. They were more likely to occur after the second dose, and they were occurring less often in those older than 55, which was less than 3% compared to younger participants, which was less than 4.6%. And then of note, Pfizer considered all of these reactions to be transient and manageable. For the Moderna vaccine, again, the most common issue was injection site pain at more than 90%, but again, manageable, followed up by fatigue, then headache, muscle pains, joint pains, and chills. Severe reactions occurred in less than 10% of those who participated in the Moderna trial. Again, more likely to occur after the second dose, but less frequent in those above the age of 65 compared to younger participants. And again, similar to the Pfizer vaccine, most of these adverse events were considered mild to moderate in severity. And then for the Johnson & Johnson vaccine, you'll notice the percentage was actually far less. Again, injection site pain was the most common one, but it occurred in only less than 50%, about 48.6%. And that was followed up by the other side effects that were known to occur in the Pfizer Moderna vaccine, specifically headaches, fatigue, and myalgia, which is basically muscle pain. And all of these were considered to be mild and moderate. Again, less common in those in the elderly population, or the older population rather, 60 and up. And for the Johnson & Johnson vaccine, they reported that most of these symptoms resolved within 1 to 2 days after getting their vaccine. Touching quickly on the AstraZeneca vaccine, because that has been submitted for approval for emergency use authorization by the FDA, and that is undergoing review and obviously has been in the news recently. Just to touch on how that works, the AstraZeneca vaccine enters human cells and introduces DNA into muscles, like what I touched on before. It makes the spike protein and triggers an immune response. It was developed in collaboration by the University of Oxford and AstraZeneca. It was found to be 76% effective against symptomatic COVID-19. And AstraZeneca did say that it was 85% effective for those age 65 and up. They did say it was 100% effective against critical disease and hospitalization. So you're thinking more along the lines there of people who are so sick they need to be hospitalized and, God forbid, need to be hooked up to like a breathing apparatus, like, a BiPAP machine for those who know what those are. It's like the big masks, or they have to be hooked up to basically a machine at the bedside that helps a person breathe. So that vaccine has been authorized for use in other countries, including Canada, the UK, and the European Union, and it's pending review here in the US. There was a concern with blood clots in Europe, but last week, there was an independent review by the European Medicine Agency, which from my understanding is the European Union version of the FDA, and they had stated it was safe and effective. That being said, there was still a concern with the South African variant and decreased efficacy with the AstraZeneca vaccine, but it was found to be effective against the other COVID-19 strains. So now, since we have talked about what the different vaccines are, I just want to go over some frequently asked questions about the vaccines to try and alleviate some concerns. So first, are the vaccines safe? Yes. All the COVID-19 vaccines being used have undergone rigorous studies to ensure they are as safe as possible. This includes meeting safety criteria that was set by both the FDA and the CDC, not just safety criteria that was created by the companies that developed it, but specifically by criteria set by the FDA and the CDC. If I got COVID, should I get the vaccine? So yes, due to risks of COVID-19 and the possibility of reinfection, you still need to get vaccinated. Now, in terms of when you should be vaccinated is another concern. If you got COVID and your treatments included drugs called monoclonal antibodies or convalescent plasma, you need to wait 90 days before getting a COVID-19 vaccine. If you're not sure if you got one of these treatments, best thing to do is talk to your doctor about what treatments you got. That way you need to know whether or not you need to wait the 90 days. If you didn't get COVID, but you did not receive these treatments called monoclonal antibodies or convalescent plasma, then it becomes more of a clinical decision, at which point you should still talk to your doctor about when is the best time to get the COVID vaccine. In terms of, can I get an allergic reaction with the COVID-19 vaccine? So serious problems from vaccination can happen, but these are exceedingly rare. So can I get the COVID-19 vaccine at the same time as another vaccine, like say hepatitis, the hepatitis B vaccine, or tetanus, or the measles, mumps, rubella vaccine? So CDC recommends that you wait at least 14 days before getting any other vaccine. That includes the ones I just mentioned, and the flu shot or the shingles vaccine if you get your COVID-19 vaccine first. And if you got another vaccine first, wait at least 14 days before you get your COVID-19 vaccine. That being said, if a vaccine is inadvertently given within 2 weeks of another vaccine, there's no need to restart the COVID-19 vaccine series. You just keep going. If it's, let's say, the Moderna or the Pfizer vaccines, you just keep going and finish the vaccine series as indicated by those different vaccines. And if you got the Johnson & Johnson vaccine, there shouldn't be any cause for alarm. If I am vaccinated, can I still get COVID-19 or spread it to other people? And the answer is yes. So these different vaccine trials did show that a very small percent of people still got COVID, but had less severe symptoms. And yes, there is still that risk of asymptomatic spread. Like you could have 0 symptoms and still spread the virus. So can I get the vaccine while pregnant or breastfeeding? So pregnant people in a group recommended to receive the COVID-19 vaccine may choose to be vaccinated. This includes healthcare workers, etc. But there is a clinical decision here aspect involved. So best thing to do would be talk to your doctor if you have any other concerns before getting the vaccine. That being said, and it says right here, there is no data available on the safety of COVID-19 vaccines in lactating women or on the effects of messenger RNA vaccines on breastfed infants or milk production or excretion. That being said, the messenger RNA vaccines such as Pfizer and Moderna are not thought to be a risk to breastfeeding infants. I will add that within the last few days, the CDC did have surveillance data that surveyed healthcare workers who did get the COVID-19 vaccines and were either pregnant or that were pregnant at the time, and they were found that they were actually able to give antibodies to their newborns after they got the vaccine. So there is that. I just wanted to provide a little update. And in terms of what does fully vaccinated mean, because that's a term that's been talked about in the news lately as we try to get back to, some semblance of what our lives were like before the pandemic. So fully vaccinated, it means 2 weeks from when you got the last dose of the vaccine. So that means 2 weeks from the second dose of the Pfizer vaccine, 2 weeks from the Moderna vaccine, or 1 week after the Johnson & Johnson vaccine. And that's basically the amount of time needed for the vaccine to take full effect. So like, let's say you got your second dose of the Pfizer vaccine or the second dose of the Moderna vaccine today, March 30th, you would consider to be fully vaccinated 2 weeks from now on April 13th. And if you got one dose of the Johnson & Johnson vaccine on today, March 30th, you would be considered to be fully vaccinated 1 week from now on April 6th. And still some more frequently asked questions that we've been asked. Once I get the vaccine, do I still need to wear a mask, social distance, and wash my hands? And the answer is yes. So unfortunately, the pandemic will continue until we get to that herd immunity. You can still spread COVID-19 even if you are vaccinated and have no symptoms, like I touched on before. That being said, the CDC has announced criteria or guidelines for what people who are fully vaccinated can and cannot do. So if you've been fully vaccinated, you can gather indoors with other people who are fully vaccinated without wearing a mask. So you also can gather indoors with unvaccinated people from one other household. Again, one other household. For example, visiting with relatives who all live together without masks, unless any of those people or anyone they live with is at an increased risk for severe illness from COVID-19. We'll touch a little bit on what that increased risk means, but it's stuff we basically have talked about in the news, like people who are elderly or who have a lot of underlying medical problems. That being said, if you've also been around someone who has COVID, you do not need to stay away from others or get tested unless you have symptoms, according to the CDC. That being said, they do have that little caveat that if you do live in a group setting, like a correctional facility or a detention facility or a group home, and you're around someone who has COVID, you still need to stay away from others for 2 weeks and get tested even if you don't have symptoms. So in terms of where can I get the vaccine, I know Dr. Stewart's already touched on this a little bit, but just for around here, there is that Alameda County resident vaccine notification form. You can go to that website right there and you click on get notified when it's your turn. You can also visit the myturn.ca.gov website, and different pharmacies, including CVS and Rite Aid, according to Alameda County website, are offering COVID vaccines. Obviously, vaccine tourism has been a thing that's been going on for the last couple of months now. So if you want to go to a different county, like say Santa Clara County or Contra Costa County, best thing to do would be to check with the healthcare provider there or the pharmacy there when you make your appointment. Now, again, talking about the mutations, also known as the variants, because that is something that has been talked about a lot in the news lately and has been a concern with different doctors and different professions. So the thing to remember is that viruses constantly change through mutation, and new variants of a virus are expected to occur over time. So, to use a historical example, that's why we do need a new flu shot each year, because viruses like the flu virus and the COVID virus, remember, 2 different viruses, they do mutate significantly and they do change over time. There have been several COVID-19 mutations discovered since the pandemic began. A few of those I have listed right here. The most common one that's been talked about is the UK variant. This is the one that is far more contagious and far more dangerous than the first strain of COVID-19 that did appear. But as far as we know right now, and research is ongoing with this, the vaccines that we do have distributed here in the US are able to provide a significant, still do provide protection against the UK variant. The other one that has been talked about is the South African variant. And with the South African variant, the vaccines that we do have here in the US still do provide some protection against the South African variant, but there is that concern with some decreased effectiveness, and I will touch on that in a little bit more. There is also the Brazilian variant, the Southern California variant, and the New York variant. The UK variant, like I I just described is most infectious and more lethal, and it is likely, according to a lot of the doctors and public health agencies, to be the most common form of COVID-19 in the near future. But again, the Pfizer, Moderna, and Johnson & Johnson vaccines, based off the research that we have and the information we have now, does provide a significant amount of protection against the UK variant. The South African variant is concerning for decreasing vaccine effectiveness. That being said, there is also research going on right now between all the different vaccine manufacturers in terms of the South African variant, in terms of whether or not another vaccine will be needed in the future, and also in terms of effectiveness. Next slide, please. More about the variants. So like I mentioned already, scientists continue to study these new mutants while looking for new variants throughout the world. Vaccines given now still provide protection against these variants. In the future, it is possible that you may need a booster shot for COVID to protect yourself against these new variants. And it's similar to how you're supposed to get a new flu shot each year. In terms of risk factors, this is stuff we've it's been talked about a lot, but just to touch on it quickly, increasing age, anyone can be infected, as we've seen, but middle age to the older population are most commonly affected so far and are most likely to have severe disease. Comorbidities are associated with more likely to be associated with severe illness and also mortality, and that includes cardiovascular disease. So basically anyone who's ever had any heart problems, like a heart attack or a heart bypass, or any problems with their circulation. Diabetes, hypertension, also known as high blood pressure, chronic lung disease. These are the people who have COPD, chronic obstructive pulmonary disease, asthma, emphysema, which is similar to COPD, if not the same. But anyone really, any lung disease, cancer, chronic kidney disease, and that includes people on dialysis, people who are overweight, and smokers. Again, please, if you do smoke, please try to quit. It is doable and will help you out in the long run, not just with COVID, but with so many other things also. So in terms of socioeconomic background and gender, so far, unfortunately, in the pandemic, Black, Hispanic, and South Asian people comprise a disproportionately high number of infections and deaths, and men also account for a disproportionately high number of critical cases and death. In terms of what COVID symptoms should you be looking for, again, this has been stuff that's been talked about by public health agencies and doctors, but just to touch on it quickly, cough, the most common symptom occurring in 50% of cases. Fevers, either subjective, which is basically you feel like you're having a fever, or a temperature of 100.4 degrees or higher. Translated, that's 30 degrees Celsius. Myalgias, which is basically muscle aches, headaches, dyspnea, which is also the medical term for shortness of breath or having trouble breathing, sore throat, diarrhea, nausea, vomiting, and then less likely, but has been talked about, that loss of smell or taste, abdominal pain like stomach pain, and rhinorrhea, which is basically a runny nose. That does occur and has been talked about in the news, but it occurs in only less than 10% total COVID cases. In terms of recovery, so the time to symptom resolution depends upon pre-morbid risk factors, like basically the risk factors a person had before they got COVID, the severity of the illness, and like basically how sick the person got, and the symptoms that were experienced. So fevers, chills, and olfactory, gustatory symptoms, so like smell and taste, those typically resolve within 2 to 4 weeks. That being said, the other symptoms like fatigue, dyspnea, again, like shortness of breath, tightness in your chest, cognitive deficits, and psychological effects, unfortunately can last a lot longer. And in fact, there's a term for it now. It's called post-acute sequelae of SARS-CoV infection, abbreviated PASC. Symptoms related to this include fatigue, GI problems, quote unquote brain fog, inability to focus, depression, anxiety, sleep difficulties, and impaired lung capacity. So it's basically like an impairment of your lungs to get air in and out. That, these symptoms can last a lot longer, and that goes into that condition called PASC. As of right now, research is ongoing, and unfortunately, there's no like magic pill, no magic cure for it right now. Basically, what we do this thing called supportive care, where we just treat the symptoms as they pop up. But again, research is ongoing. So unfortunately, when will the pandemic end? It's a question that we've been asked a lot. And unfortunately, right now, there's no clear timeline for when the pandemic is going to end. Sorry. There are many things that need to happen. This includes achieving herd immunity. It's unclear how many people will need to be vaccinated. Different public health experts have said we need to get to about 75 to 80% of the total population before we can start talking about herd immunity. We also need vaccines that provide effective protection against all of the COVID-19 strains and variants. That includes the possibility of getting repeat COVID vaccines in the future, similar to how the flu shot, how you need a new flu shot each year. But that's still to be determined. We also need effective, easy to administer treatments. As of right now, all our current treatments are only given IV. Specifically, that is like into a person's veins. We also need acceptance of vaccinating, mask wearing, social distancing, and hand washing, which unfortunately has been a political issue at times and has been something that people have started to sort of slip up on in recent weeks to months. And basically, what can we do to help as a community? So when the vaccine becomes available to you and your doctor says it's okay to get the vaccine, please try to get the COVID vaccine. Encourage others to get vaccinated if it is safe for them to do so. Promote and respectfully encourage mask wearing, hand washing, and social distancing. And if you do feel sick or if you have signs or symptoms, please quarantine immediately, call a doctor, and follow their health instructions and instructions of the public health department. And that's what I have, but thank you. But obviously we've covered a lot of ground there, and I imagine we do have a lot of questions. So I think we can bring Dr. Stewart back in, and if there's any other questions, we can take them now.
Just one thing I quickly wanted to mention just before we took the questions was respect to where you can get the vaccine. Obviously, I was talking about Washington a lot, and we do on our foundation website have a call-in number. There is also a link, which right now I think it's been intermittently live, just given our trying to react to the demand and supply, and we don't want to schedule if we can't give the vaccine. But I can give you the phone number. It's 510-248-8200. So that's on the Washington Medical Foundation website as well, but I wanted to throw that out there.
Okay, this is Tanya James. I'm a vice president of Fremont Bank, and I'm going to be fielding the questions for everybody. Thank you, everybody, for being here, and thank you, doctors. This has been so informative. First question I have is, do you think the government will limit travel because of the variants?
I think it's difficult to say. I mean, like right now, with the way the vaccines have been rolled out, we've been able to get it out, to all 50 states. And in terms of how the variants will affect the pandemic going forward, I mean, the different vaccine companies are working rather on vaccines targeted to new variants and are looking at the currently available vaccines and how they protect against the variants. That being said, also in terms of since the vaccines that we do have still provide some semblance of protection, I think it's a little bit difficult to say, like, will there be a specific travel restriction to a certain part of the country because, like, oh, let's say this area has a lot of the UK variant or this area has a lot of the South African variant. We can't really say right now if, that there will be a specific restriction in like a specific part of the country or the world.
Thank you. Okay, next question is, there's a couple about the timing and will I have to get a booster, and does the booster have to be the same original vaccine that I was given? So if for example, if I had Pfizer, do I have to get Pfizer if there's going to be a booster that comes out, or will that matter, or do you know?
Right. So in terms of right now, like the CDC recommends that if you got, like say Pfizer for your first vaccine, you should get Pfizer for your second vaccine. And similar for Moderna, like Moderna first dose should be Moderna second dose. There haven't been any trials or any published data that compare mixing and matching. And in terms of like booster shots going forward, like the different vaccine companies are working on, booster shots right now targeted at the different variants that are popping up, but it's too soon to tell whether or not, like if you got the Pfizer vaccine to begin with, that you have to stick with Pfizer. And if you got the Moderna vaccine, you have to stick with Moderna going forward.
Great, thank you. Is there a benefit to a vaccine based on the mRNA versus the DNA?
So no, the different vaccines that are available right now, Johnson & Johnson, Pfizer, and Moderna. I know like there's been a lot of debate about like, oh, the Johnson & Johnson vaccine, the percent effectiveness didn't get to the 90s, but they all provide a good amount of protection against COVID. So in terms of, if there's like a vaccine that's available to you, please do get that vaccine right now. Don't try to wait for, let's say, oh, the Moderna vaccine is going to be available in 2 weeks. I'm going to wait for that one. No, don't wait. If the vaccine's available to you now, please try and get it.
Yeah, the only thing I would add is that, even with respect to, supposed decreased effectiveness, to symptomatic COVID, all the vaccines available provide incredible protection against and death. And that's really, when you think about why we get the flu vaccine, that's why we get the flu vaccine. And Dr. Katalia even mentioned in one of his earlier slides. So I think, I think that's something that, in my opinion, could be messaged better from the government. I do know now the Alameda County has something to that effect, where that's kind of their top line on the 3 different vaccines. So I think that's a really important thing to keep in mind, that as far as the endpoint of having to go to the hospital and maybe getting on a ventilator and possibly dying, every vaccine works great with that respect so far. And so that's just another reason to get whichever vaccine you can get when you can get it.
Thank you both. I know we're getting right to 6:30 and we have several more questions, and I know the doctors were willing to hang on a little longer. So I just want everybody to know, if you have to leave us, we appreciate you being here, and good night, but we're going to keep going so we can get your questions answered. The next question is, can you comment on whether taking D3 can help in staying healthy during the pandemic? And if so, what is a suggested daily dose?
So, I mean, there is some literature or some research that has gone into vitamin D3, and there is some data to show that vitamin D3 or low levels of vitamin D did predispose some people to getting COVID. But in terms of like, is that like a hard specific thing that we recommend? The answer is no, because look, if vitamin D3 prevented everybody from getting COVID, we'd be giving it out the same way we were giving the vaccine. In terms of the dosages is really going to vary from person to person. It depends on, a lot of these medications depend on like the person's size, depends on how good their liver is, how good their kidney is. So I can't really comment on a specific dose. That's something that's best talked to your doctor about.
Thank you. Do you anticipate the public requiring additional vaccines over and above the ones you've already discussed to address the new variants?
It's a little bit too early to tell. I mean, we fortunately fortunately, the Pfizer and Moderna and the J&J vaccines still provide a decent degree of protection against the variants that we know about. But that being said, there is still research that is ongoing with all these variants that we know about, and different researchers are always on the hunt looking for, the possibility of new variants that are yet to be discovered. So the answer is possibly, and it's something that we did kind of touch on earlier, but it's a little bit, it's to be determined right now.
Okay, and I think you already addressed the fact that we might be able to, or we might need to take these annually. Several people asked, well, we need to take these annually. And in your opinion, do you think that that's a yes?
It's too early to tell.
Too early to tell, okay.
Yeah.
Okay. Is there some protection after the first vaccine?
Yes, the CDC did have a surveillance study that was published just recently amongst healthcare workers. And there has been some other data to show that there was some semblance of protection after the first dose of the vaccine. The reason why Pfizer and Moderna do recommend 2 doses of the vaccine is because they found that the effectiveness was a lot better after the second dose. That's why they recommend 2 doses. But the short answer is that yes, you do still get some level of protection against after the first dose, but you get the best protection after that second dose of Pfizer and Moderna vaccines. And then the Johnson & Johnson vaccine still obviously provides a great deal of protection after the first shot.
Thank you. Here's a question. If I took the first vaccine and have side effects such as back pain, do I have to take the second dose, or can I just not take it? And then what is the risk of not taking the second dose of Moderna?
So yes, I would still recommend that you get the second dose of either the Moderna vaccine or the Pfizer vaccine, even if you did have some of these symptoms. Back pain is a relatively common side effect after getting these COVID vaccines, as we had kind of talked about in the talk. Like we touched on like myalgias and joint pains as something that does occur relatively frequently. And definitely the risk of not getting the second dose, where you don't get that full optimal protection, is definitely much worse than dealing with some back pain that would get better with time.
Thank you. Can you talk about long haulers and any research or work that's been done on those symptoms and what people can expect or look forward to, maybe with medications or support from the medical industry?
Right. So PASC, that post-acute sequelae of COVID, there is a research that is ongoing right now in terms of like the different symptoms that people are feeling, in terms of like prolonged recovery period and what can be done. Unfortunately, right now, there isn't really much to do or much we can do other than just treating the symptoms as they pop up. That being said, the research is ongoing. So hopefully in the coming weeks to months, we'll have a better idea of what we should be looking for and what we can do to help out all of these people, the so-called long haulers.
Thank you. When will the vaccine be officially approved rather than just an emergency waiver?
So in terms of right now, like the FDA has given that emergency use authorization, and the clinical trials are ongoing. Definitely like these clinical trial participants who participate in the different vaccine trials in summer and fall of 2020, they're going to be hopefully followed for months to even years going forward. That being said, there is no known timetable for the full FDA approval, as opposed to just the emergency use authorization.
Okay, and then the second part of her question was, will there be a conventional vaccine rather than an mRNA or DNA one for that matter?
Right. So in terms of like, this conventional versus messenger RNA, like the messenger RNA, like I know there's been a lot of concern with how, like it's a newer technology, but this has been around for, quite some time. There's been a lot of research. So in terms of the like a newer vaccine, like eventually, yes, there could be newer vaccines coming out, but are they going to be necessarily using like older technology, for lack of a better way of saying it? It's not quite clear. The COVID vaccines do use new technology that has been shown to be safe in large clinical trials.
Thank you. And then a follow-up question, do you anticipate that the mRNA could possibly lead to breakthroughs with other diseases like cancer?
I mean, it's definitely possible. Definitely there will be more research going into messenger RNA vaccines to treat other diseases in the future.
Where does the DNA come from for vaccines?
In terms of the vaccines, they're made in different labs. They use scientists were able to figure out the DNA sequence of the spike protein, and they were able to make a small amount of genetic material and put it into these vials that are injected.
Okay, I think we have answered all of the questions. If anybody has any last minute ones, type quickly now. Otherwise, let's see. Will COVID-19 be eradicated like smallpox, or will we live with it like the flu?
It's going to be unfortunately, it's going to be very difficult to eradicate COVID. The reason why smallpox was able to be eradicated is because it doesn't have what we call an animal reservoir. It can't retreat into animals the same way that COVID can. Smallpox is pretty much limited to humans. That's why we're able to basically vaccinate everybody. And then there was nowhere left for the virus to go, or for the smallpox to go. And then that's why we're able to consider it eradicated. Yeah.
Okay. When will it be safe to go on a cruise?
So there's no specific timetable for that. The only thing I would say in terms of cruises is that even before the pandemic, they were already at high risk for outbreaks. Remember, for the last few years, even decades, we'd always hear about outbreaks of other viruses like norovirus on cruise ships. So it's very difficult to say right now, if it'll be if and when it'll be 100% safe to go.
Is there any chance to develop breast cancer with the vaccines?
No.
No. Okay. Is eating in restaurants safe since we need to remove our masks to eat, and waiters are going from the table to table and utensils are touched by the staff?
I believe it is. I mean, when I have dined out in the pandemic, I usually always wear a mask unless I'm actually putting food in my mouth or drinking something. Restaurants I know have had to abide by very strict, stringent public health protocols. And all the waiters I've seen at these restaurants, they know how to wear masks properly. And, there has been a lot of improvement I've noticed, at least outwardly, in terms of sanitation in these restaurants. So, it's not, going to be 100% safe, but you should feel reasonably safe going out to a restaurant.
Thank you. And one last question. Was the strain of COVID genetically tampered with from Wuhan?
I haven't seen any evidence to suggest at all that, this virus was made in a lab or it was intentionally released out to the world.
Great. That was our final question. I want to thank both you, Dr. Catalia and Dr. Stewart. You have been wonderful answering all these questions. and your presentations. We have no more questions for tonight, and just we appreciate you, our relationship with Washington Hospital, and everything that you have provided us tonight. And the comments keep coming in with the thank yous, and wow, what a lot of great information. So we appreciate you and everything you gave to us tonight, and thank you for going over on the time.
Thank you for having us.
All right, we
Yeah, thank
appreciate
you.
everybody. Thanks to all our clients and associates who joined us tonight.